Health experts have clarified that HMPV virus is not a new virus. It was first identified in 2001 and it has been circulating in the entire world since many years. HMPV spreads through more during the winter and the early spring months. On recent reports, the cases of HMPV in China, the Health Ministry, the Indian Council for Medical Research and the National Center for Disease Control are keeping a close watch on the situation in China as well as in the neighboring countries. WHO has taken cognizance of the situation and will share their report shortly with us. The country data for respiratory viruses available with Indian Council for Medical Research (ICMR) and the Integrated Disease Surveillance Program has also been reviewed and no surge in any of the common respiratory viral pathogens is observed in India. Joint Monitoring Group meeting was held under the chairmanship of Director General for Health Services on 4th of January 2025 to review the situation. The health systems and surveillance networks of the country remain vigilant, ensuring the country is ready to respond promptly to any emerging health challenges. There is no reason to worry.